Good day, everyone. We hope you are staying healthy and well, and we want to thank you for spending time today to join us for Monster's webinar on triaging healthcare hiring. So we understand that your time is very limited today. We will do our best to keep this to 30 minutes or less. Because of that, we won't be able to offer a Q&A at the end. However, we have seen some people submit questions in advance, and if you choose to do so at the end, please use the comment feature below, and we'll make sure that we'll try to follow up afterwards. So, hi, I'm Megan Goulet. I am the Principal Marketing Manager at Monster Worldwide, and I am thrilled today to introduce our panelists. We have Dan White, who is our President of Workforce Solutions at AMN Healthcare, and Ms. Marissa Zaroff at, oh my gosh, and I butchered it. I'm sorry, Marissa. Marissa Zaharoff, and she is the President of Nurse and Allied Operations at Cross Country Healthcare. So as all of you know, they will be speaking with us today about the challenges they have faced during these difficult times, as well as the lessons that they have learned along the way. Finally, before we jump right in, I won't be able to man the comments because I am sharing my screen right now. However, please know that we will be sending a recording of this webinar afterwards. We understand schedules are crazy these days. You know, if you have to jump in the middle of it, don't worry. Anyone who's registered will receive a recording. So with that, further ado, let's get started. So Dan, can you please tell us a bit about yourself?
You bet. So first of all, thanks everybody for joining us. This is a fun time, as it were, to be in healthcare these days. I'm the President of Workforce Solutions at AMN Healthcare, and I've been here now roughly 6 years. I lead all of our go-to-market activities for AMN for our most strategic customers. So that would be solution design, implementation, management of the various programs. And I'm also responsible for a few of our workforce technologies that are the foundation for some of these programs. And as it turns out, some of those assets have been really important to responding with speed and agility in this crisis. So happy to talk about any of those things today.
And Marissa?
Yeah, again, I'd also like to take a minute to thank you for attending today's session sponsored by Monster. My journey in healthcare staffing actually began as a travel and per diem nurse, and I've been in the industry now for 17 years. I believe as a master's prepared nurse, I provide a really unique perspective relative to both our candidate and client experience. My focus today is really centered on business optimization, meaning finding new ways to leverage emerging technology to keep the business competitive. It comes with a combination of careful analysis, internal reflection, and continuously seeking new perspectives. That said, on behalf of Cross Country Healthcare, I really can't thank our first responders enough for their sacrifices on the front line. We are eternally grateful, and we are here for them as they fight the fight.
That's great. Thank you both. So as everyone knows, and why we're here today is the COVID-19 pandemic has really swept the nation, and there has been, huge nursing shortages. So actually, Marissa, can you start us off? How has Cross Country Healthcare been able to help fill these gaps?
Yeah, look, our mission since the onset of the COVID pandemic has been simple. Go the extra mile to ensure our healthcare providers and clients have the support and resources they need when they need it. Pre-COVID, there was already a significant nursing shortage. Our clients had high demand for both nursing and allied healthcare professionals. And at that point in time, we leveraged a variety of communication channels to aggressively recruit talent. Such as phone calls, emails, texting, digital marketing, and social media. We kicked off 2020 and boom, COVID hit. So Cross Country needed to closely monitor the impact of COVID as it was and still remains a very fluid, ever-changing situation day to day. We created a COVID SWAT committee and action plan. This actually allowed us to come to the market quickly and be consultative for our clients. This included keeping them informed on how we would mobilize our healthcare resources and meet their impending demand. From a talent acquisition standpoint, we pivoted to using text and social media as email marketing was just way too saturated. I'm sure all of you experienced this. Every business you ever set foot in, every app you ever signed up for was emailing you their plans for COVID. Additionally, your state, local, county, schools were also sending email updates as well. We quickly understood this channel of communication was not a viable route to engage talent. So texting and social media really became our go-to strategy. As they are obviously more efficient and more effective, we were able to provide information real time, create a COVID resource center, respond faster to inquiries, and establish other means for our healthcare providers to gain access to jobs. In addition to the high demand we experienced for nurses, CrossCountry also saw an increased demand for allied health professionals, such as respiratory therapists, lab professionals, and other modalities during the crisis. It was really interesting to note that we also saw a shift in demand for local services, especially for screeners, triage and call centers, and telehealth services. Some of these even outside of the traditional healthcare staffing realm. Now, during this time, we really focused on accelerating our hiring process, which meant working with clients to relax some of their more stringent credentialing requirements in order to hire providers quickly to staff their immediate needs. Look, in a national crisis, we saw the nation ask everyone to help, which included expanding nurse licensure reciprocity, tapping new grads to jump in, and even asking retirees or those with inactive licenses to rejoin the workforce. This helped CrossCountry widen our talent acquisition net. At the end of the day, healthcare staffing is a highly competitive market, and CrossCountry continues to work closely with our clients to offer competitive pay packages.
That's great. Now, Marissa, you had a lot in there, but I was really attracted to your different ways of reaching candidates and different ways of, having some creative solutions in there, especially going beyond email for texting and social. Dan, has AMN Healthcare been doing anything differently?
Boy, yes. As you can imagine, I first want to echo a lot of the comments that Marissa made, especially the gratitude for what our nurses, doctors, allied professionals all have been doing during this crisis, whether for us, CrossCountry, or really anybody else. They have been doing clearly heroic work in many ways. I think, to go back to your question about, what's different, we too have a very diversified strategy about where to meet clinicians. Typically, the way I think about that, and it kind of echoes what Marissa just said, is you really need to meet the candidates where they are. If that's social media, if it's text, if it's phone, if it's web, email, any of those things, you need to be very broad about how you connect with them, because again, they're moving around, they're working night shift, whatever that is, you're trying to meet them where and when they're able. And so what I think about that meaning is it's really focused on one-on-one kind of communication as opposed to one-to-many, which, in normal circumstances, perhaps staffing firms or other internal recruiting functions can do that sort of one-to-many sourcing. Just not possible when you need to move somebody in days or even a week to, across the country to a very difficult position. Another thing I would add on top of what Marissa has said is that AMN has a pretty substantial leadership business. And one of the things that we found is a need for interim leaders, trainers, people that can really help onboard quickly and ramp up people, whether it's in existing hospital settings or even in, probably more importantly, these field hospitals that state and local governments have been setting up. And so one of the things that we did differently is help craft a playbook for especially those settings where all you have is an empty building and you need, a care model and leadership and all of these other things that are required to actually run that operation. So we put all of that together and tried to help lead some of those conversations with clients. And then finally, we've been finding ourselves doing a lot of very rapid innovation. And so one of the things that we introduced in this period so that we could address credentialing and these other requirements that Marissa just talked about, we introduced our AMN Passport app, which really helps take some of these one-on-one communications we were talking about and make them asynchronous as well, which is even more important when you're in this kind of a circumstance.
I love hearing the approaches that both of you are taking, and I'm sure our listeners are as well. Obviously, I think, Marissa, you'd mentioned it. There was a shortage before this as well, facing challenging times. What have you found to be, your biggest hiring challenge right now?
Well, navigating uncharted waters of a pandemic, for sure. I think we're all kind of feeling that. Mm-hmm. And like many of you, cross country had to quickly pivot to a fully remote corporate workforce. That was a new situation and state for us. And we did it in less than a week's time. So thinking about that, all of our offices, all of our locations, moving that at that speed to a work from home environment. So that was one of the greatest changes. And look, we're all working through this unprecedented time, and I think the challenge has been staying very flexible and nimble. It's required us to really respond quickly to get our healthcare providers to the places where they're needed most. We've also seen hiring remote recruiters to be a new challenge. Think about it. We're bringing people into a virtual workforce, right? And that's new even to us. So we're leveraging technology to screen and engage candidates, to get them onboarded, and ultimately change the way we monitor productivity and performance. Lastly, I'd say another probably more personal hiring challenge is knowing we're sending our professionals into an environment where they could be exposed or potentially get sick. They are truly making monumental sacrifices for their community as they go to the front lines to serve patients, and cross country really can't thank them enough for their service.
So true. And then Dan, are you facing the same top challenges as well with AMN?
No question. Like cross country, we went completely virtual in a week, which was a challenge, no question. We happen to have been making some investments so that could happen. God forbid that those investments weren't made. A couple of the things that I'd like to maybe emphasize or add to what Marissa already said is that I think one of the things we would like to help our customers do better moving forward, and it was certainly one of the most difficult parts of this response to the pandemic, is getting clients to really understand and forecast what they need. It's really easy to panic and say, I need hundreds or thousands of people to help. And that's certainly understandable in the circumstance. However, if you over ask for an amount of people, that prevents us from moving them to somewhere else where they might be needed as well. And so helping them think through how to do that now in this circumstance, and then in the future as well, is something that I feel like needs to be a constant part of our dialogue. We happen to have some pretty sophisticated technology and capabilities around forecasting and scheduling and making sure there's optimal staffing in place. And so we leveraged some of that in these conversations as well. I want to pivot back to what Marissa said about credentialing. We added hundreds more resources, whether they were redeployed from other parts of AMN or just brought on to help us with getting through the credentialing gauntlet, if you will, during this period. And they're still here, and we're we're still responding in many places. So as Marissa said, we've seen the curve flatten a bit, but there are parts of the country right now that are still facing, some of the worst of it. And so one of the other big things that we have been working hard on is national and state level support for license reciprocity and some of these other obstacles, candidly, that it takes to move resources rapidly. And so those two, I think, have been great lessons learned during the process that have to continue moving forward as well.
That's great. Yeah. So I love hearing about, all of the support that you're bringing, and both of you, of course, expressed your gratitude towards those. And I'm seeing more of those stories come out. There's so much of the negativity that's out there, but we're seeing more of that good news that's coming out. So Dan, I want to turn to you. What's a bright spot that you've seen through all of this?
So probably the first bright spot is, while tragic in many, many ways, when you look at the numbers, most people that we spoke to were expecting it to be worse than it is. And so for me, sort of the first bright spot is we acted quickly, and we held off what could have been, a far worse situation. I think there's another, terrific part of it internally to AMN, but also in partnership with our customers, is that, we saw ourselves, just as Marissa said, coming together very quickly, uniting behind a single purpose that has been really inspiring for us, to watch the news or hear stories from the front lines about how someone we've been able to put in a position to help really has done so and has made a difference in a lot of people's lives. And that's personally one of the reasons why I love being part of this business. And it's absolutely been, first and foremost right now. So there's this bias towards action, right? Marissa said it too. Mobilize your workforce, get them at home, get them all focused on the right things. We've seen that here at AMN, and it's been, regardless of title, everyone raising their hands to do the right thing. It's been really terrific to see. I think secondly, on the innovation front, we took a lot of action and said, hey, what can we do differently with assets that we have to help out in a given situation? And within about a week's time, we pivoted one of our technology groups to create this open talent marketplace that allowed for us to stand up essentially a virtual marketplace for talent to be acquired for these state and other facilities. We had intended on doing that all year long, did it in weeks, and so 9 months ahead of our existing plans. We also expanded our credentialing capabilities. We made an acquisition in that space about a year ago and have been using our Silver Sheet platform and essentially giving it to those who needed it for free during this COVID period. And then finally, I think, we've done this by remaining very focused on our clients' needs, what their objectives needed to be, and also, remaining calm, offering points of view, helping them, embracing them in ways just to say, hey, we're here with you. It's okay, right? We're going to get through this together. And really, took our CEO's message and lead on just do the right thing. It's what needs to happen right now. And it's what all of our employees, all of our clinicians on assignment have been doing now for weeks and months almost now. And it's what our clients and our nation needed most. And so for me, all of those are tremendous bright spots for us and our industry.
Thank you, Dan. Yeah, it's unbelievable to hear both how AMN Healthcare and Cross Country have been able to pivot so quickly between task force and escalating things from a 9-month timeline to really respond to this action. Marissa, do you think that there's anything that you're doing now that would inform or change how you approach healthcare hiring in the future?
Absolutely. We are certainly evaluating our speed across country, in a situation with forced social distancing, recruiting and getting providers to their assignments as quickly as possible is truly critical. Dan's, alluded to this, our clients have been much more open in modifying previous processes or hiring criteria. And that was necessitated by changes relative to travel, licensure, and shelter in place. We also learned a lot about flexing our credentialing process with the daily, executive orders that impact our normal day-to-day operations. It's when you're getting the volume or receiving the volume to be able to clear and credential these individuals to put them to work within, 24, 48, 36 hours, it's a monumental task, but I was and I'm very encouraged, to see that when there is a need, our clients are absolutely much more open to ideas and innovation. And I absolutely love seeing the creativity. We've seen plenty of solutions that have been born from this pandemic, everything from virtual learning, onboarding, virtual classrooms, and even some of our clients are completing on-site health screenings upon arrival. And lastly, we're really actively exploring new relationships with community partners. I'm sure many of you are aware of the generous offers from JetBlue and Hertz, but there are so many others providing similar offers to our first responders. It's truly inspiring, and I look forward to cultivating more of those relationships in the future.
That's great. Yeah, I hope so as well.
Yeah.
As we're all moving so quickly, and you're talking, I think, Dan, you were talking about, trying to get people to prepare better in the future and planning ahead, right? Is there anything that you think you or staff, health and staffing as an industry could be better prepared for or handled differently?
Yes, I'll go back to a few of those basic things. I think one of the first thing that even as a country we need to be much better prepared for and with is for things like personal protective equipment for our frontline caregivers. I think we need a better answer there, clearly. We need to ensure the safety of the people that are caring for us at the end of the day. And so that needs to be a top priority for our systems and our government moving forward for sure. Innovation is needed. I think both we and Cross Country have found ourselves to be maybe better at it than we might have thought. And, the situation sort of inspired us to do that. So things like telehealth, better credentialing, better licensure, all of those sorts of things that we've been talking about are critical, I think, moving forward. I also think our clients need to think about their total workforce needs, because while, Marissa and I have been talking a lot about the clinical needs, they're supported by IT and clerical and facilities and all kinds of other folks, right, that make that engine work well and support them in their day-to-day. So I think those things need to stay on the front as well. And then finally, I would say this crisis has really shined a light, frankly, on the need for better mental health before, during, and after this crisis. Whether it's in a long-term care facility or outside of that kind of an environment. We need to be focused on the things that maybe in the past have felt like they were in the margins in health.
Perfect, thank you. So it looks like we have about 5 minutes left, so we're just gonna have one more question. I'd love for both of you to be able to answer this one. Do you have any advice for companies in your position who might be facing nursing or healthcare staffing shortages? So Marissa, I'd love to start with you, and then Dan, I'll have you wrap up.
Great.
Yeah, we all understand and recognize that these are unprecedented times in a very competitive market. Cross Country believes, first and foremost, we have to take care of our healthcare professionals who are taking care of the nation in such a selfless way. And even though we're responding to the crisis, we are pro-competitive and always thinking about how we can be more creative, more innovative, and really coming forward with new ideas and solutions. And we truly believe that technology is a key driver in our industry going forward. Our industry has to and must continue to evolve to meet the changing needs, as well as continue to provide a great experience for both healthcare providers and clients alike. I think that's important for anyone.
Great. Dan?
I'll probably go back to some of the themes that we've been sharing. I think both Marissa and I think the first one is to have maybe a renewed or double down emphasis on a bias towards action. Don't sit around, overthink this stuff. Get after it, make some stuff happen, because this period of time is only emphasizing the need for that. Part of that bias for action needs to be what Marissa said around innovation. We need to think about things differently. The way things have been done might have been fine in the past. They can't be the way moving forward. And so whether that's helping healthcare providers, think about their roles or how they do things differently, finding, ways to candidly, help all of us get out of our own way. Sometimes, we just need to think about things differently. And that certainly has been a big part of our learning going through all of this. And then again, I'll go back to that notion of helping our customers anticipate what they need. They're experts at delivering care, and we should be experts at helping them manage their workforce and thinking about how they can do that better moving forward. This won't be the last time that we have to deal with a crisis like this, whether it's, God forbid, it's this big again. But there are things like labor disruption or weather situations or other things that really create sort of kinks in the way the process might work. And so again, mobile, telehealth, any of these other sort of innovations can really help them think how it should be done.
Great. Well, thank you so much for your time today. We are incredibly grateful to hear from two leaders in healthcare staffing. So thank you again. And thank you all for attending this webinar. As you all know, we are facing unprecedented challenges as the situation evolves, and Monster is doing our part to help with this need as well. We're actually offering free access to 30-day job postings for frontline workers, healthcare workers within staffing. So this offer will extend through May 31st. We'll send a link about it for afterwards, but anyway, the point is, thank you all for joining us today. And from all of us at Monster, AMN Healthcare, and Cross Country, please stay safe and please stay healthy. Thank you, everyone.